Hey gang, welcome to week 6 pre-lecture module. In today's module, we will cover the basic concepts of the bony structures of the spine, as well as the ligaments of the spine. Here's a list of the learning objectives. Feel free to take a look at these, but these include both the objectives for today's lecture as well as Monday's lecture. As always, please refer to the required readings in clinically oriented anatomy and utilize the resources available to you on the library website. The vertebral column consists of 33 stacked vertebrae. The vertebrae in each of the various regions will have unique characteristics and bony landmarks, but we'll talk about those details in lecture. As far as the pre-lecture module goes, you should be aware that there are 7 cervical, 12 thoracic, 5 lumbar, 5 fused sacral, and 4 fused coccygeal vertebrae. When the vertebrae are stacked on top of one another in an adult spine, you can see there are 2 types of curves, a kyphotic curve and a lordotic curve. The kyphotic curves, or kyphosis, are what we term our primary curves. These are both found in the thoracic and sacral regions. Notice that they are convex posteriorly. In a fetus, all of the curvatures of the spine are convex posteriorly, so they are indeed kyphotic. But as a newborn and ultimately child begins to bear the weight of their head and body, secondary curves develop. We term these curves lordotic or a lordosis curve. Notice they are concave posteriorly. Now, these curvatures can be pathological if they are excessive. Notice with an excessive kyphosis, there can be a hump in the thoracic region, or in the case of an excessive lordotic curve or an excessive lordosis, there is a swayback. You also can have additional curves in other planes, such as a scoliotic curve. Now, please take note there are certain surface anatomy palpable landmarks that can help us find which level of the spine we are at. And these are going to be clinically relevant for those of you going into practice. So at the level of the scapular spine, we are at the level of the T3 vertebra. At the inferior scapular angle, T7, the 12th rib, obviously T12, and the top of the iliac crest is the L4 vertebra. Now, these bony landmarks will help you in clinical practice, but will also help you as you become more confident with the anatomical regions. The vertebrae themselves have several functions. Perhaps the most important function is going to be providing protection of the spinal cord. They also serve as important attachment sites for ligaments, muscles, your ribs, obviously only in the thoracic region, the skull, and the pelvis. A typical vertebra always has the same structures. You will have the body, the vertebral arch, which I'll color in here, the pedicle, the lamina, and processes: an articular process, transverse process, and spinous process. Additionally, we have this small region called the pars interarticularis. It's in the area between the 2 articular processes of a single side. Now notice the different views. Let's find these structures again, both from the superior and lateral view. First, the vertebral body. I'll outline the vertebral body here in red. Notice that the vertebral body is thick and sturdy. This is where the majority of the weight bearing occurs in the spine. Next, notice we have a pedicle. The pedicle is what's attached to the vertebral body. So you can see the pedicle here and here. You have 2 pedicles for each vertebral body. Again, the pedicle in the lateral view is here and here. The lamina is more posterior. Notice that the lamina here and here help complete the vertebral canal. So when taken together, the vertebral body, the pedicle, and the lamina produce the vertebral canal, or vertebral foramen. This is an important space because this is where the spinal cord resides. Again, the main function of the spine is protecting that spinal cord. Now, as I get rid of these lines so we can see our drawings again, I want to point out some of these additional processes. The most straightforward and simple to see are going to be the spinous process posteriorly and the two transverse processes laterally. Again, from the lateral view, here is the spinous process and the transverse process. These are very important bony landmarks that will have muscular and ligamentous attachments. Now, the articular processes are a little bit more challenging and difficult to see unless you see them from the lateral view. On this lateral view, you can see you have a superior and inferior articular process. The articular processes are easily viewed from this image on the bottom right-hand corner of the screen. Here we can see the inferior articular process of one vertebra stacked on top of the superior articular process of the vertebra directly below it. These two articular processes form an important joint of the spine, which we'll talk about in more detail on Monday. Finally, the pars interarticularis is an important landmark that we'll talk about clinically on Monday. However, for now, we should be aware that the pars interarticularis is the region in between the two articular processes of a given level. The vertebral column has several important ligaments. Now, many of these ligaments are continuous with those at the base of the skull, which we will talk about on Monday. However, for now, we should understand that the vertebral body has two ligaments, the anterior and posterior longitudinal ligaments, and the vertebral arch has four ligaments, the ligamentum flavum, the interspinous, the intertransverse, and the supraspinous ligaments. The anterior longitudinal ligament is a long ligament that is in the anterior aspect of the vertebral bodies. It spans the length of the spine and covers the anterior and lateral surfaces of the vertebral bodies. It is attached to the anterior aspect of the intervertebral disc as well as the vertebral bodies. This is one of the only ligaments that will help limit extension of the spine. The posterior longitudinal ligament is the opposite of the anterior longitudinal ligament, as it runs on the posterior aspect of the intervertebral disc and vertebral bodies. Unlike the anterior longitudinal ligament, it helps limit flexion, and it covers the anterior vertebral canal. Now notice that it has these lateral expansions near the area of the intervertebral disc. These will become clinically relevant for us, so keep this in mind as you come into lecture on Monday. The ligamentum flavum is a set of paired ligaments along the posterior aspect of the vertebral canal. So you can see it back here, as well as in this view here. The ligamentum flavum connects the lamina of adjacent vertebrae. Now this ligament is very, very high in content of elastin, which allows it great mobility. So there's more flexibility in this ligament than the posterior longitudinal ligament, but both of those help limit flexion. The interspinous and intertransverse ligaments, as their names suggest, run in between the transverse processes and the spinous processes, respectively. The intertransverse ligaments help limit lateral flexion, while the interspinous ligaments assist the ligamentum flavum and posterior longitudinal ligament in their limitation of flexion. Finally, the supraspinous ligament, which its name suggests, runs on top of the spinous processes on the most posterior aspect of the spine. This ligament, along with the other three, help limit flexion. Now, this ligament is very, very thin in the lumbar region, which we'll see more of on Monday. This slide provides a nice overview and review of the structures covered in this pre-lecture module. This image right here is directly from the TIMA Atlas. So take some time, make sure you understand the various bony landmarks and ligaments of typical vertebrae. Additionally, this color-coded image will be a nice tool for you to practice labeling the various ligaments and where they are found throughout the length of the spine. Be sure to review these structures prior to coming to class on Monday, as we will have a group activity over this content in lecture.